methods of the confirmed cases and the other questions concerned by the media groups. To that end, today we have invited Vice Governor Xu Jianpei of Hebei Province to brief us about the situation in our province. And also we have invited the Health Commission Party Secretary of Hebei Province, Liang Zhankai, Hebei Provincial Public Security Party Secretary, Director General An Zhongqi, and the Transportation Bureau Party Secretary, Director General Wang Puqing, and Hebei Provincial Business Bureau Party Secretary Zhang Feng, and the CDC Provincial Branch Li Qi. They will take the questions from the media together. First of all, let's give the floor to Vice Governor Xu to brief us the updates. Dear media friends, good afternoon. Since January the 2nd, 2021, Shijiazhuang and Xintai cities in Hebei Province reported the confirmed cases of the COVID-19. The CPC Central Committee and the State Council attached high importance to the situation. So the preventative and control mechanism of the State Council dispatched the steering committee and the expert panel to our province for on-site guidance. The National Health Commission and the General Office of the State Council, the Department of Publicity, and Ministry of Industry and Information, and Public Security Department, as well as the Ministry of Transportation, offered aggressive support, further cementing our confidence of conquering the epidemic. Since the outbreak of the epidemic in our province, the entire society is paying high attention. The sister provinces and municipalities took different sorts of methods to support the epidemic control in our province. We are deeply touched and inspired. We would love to take this opportunity to offer our gratitude to all of those supporting us. First of all, please allow me to report to you the updates of the epidemic in Hebei Province. Since January the 2nd until 10 o'clock on January the 8th, the total confirmed cases in our province stand at 127, including 118 in Shijiazhuang and 9 cases in Xintai. For those asymptomatic carriers under medical observation, the number is 183, including 177 in Shijiazhuang and 6 in Xintai. Over the past days, we have done the following work. Firstly, we kicked off the wartime working mechanism for epidemic control. The Provincial Party Committee and People's Government dispatched certain colleagues to guide the situation. We also organized experts to judge the overall circumstances and arrange for the control work. They go to the front line for more on-site guidance with clarified requirements about epidemic control. And our province, together with the preventative mechanism of the State Council, established the other negotiation mechanisms at national, provincial, and municipal level. Every day we meet to talk about the major issues of epidemic control. The leadership group of our province also dispatched a working group to Shijiazhuang and Xintai to guide the epidemic control work. According to the coordinated preventative and control mechanism of the State Council, we must have scientific division of labor and precise prevention and control. The Gaocheng district of Shijiazhuang City is readjusted to be highly risky area, and Xinle City, Ruida Meigui community of Shijiazhuang City, and Fenggang neighborhood office of Nangong City, Xintai, together with 17 other regions, are readjusted to be intermediate risky areas. We instantly took decisive measures with comprehensive tracking and monitoring. With the fastest pace, we organized all the relevant people for nucleic acid testing. We also comprehensively strengthened the control efforts of the urban and rural areas. We go all out to save those confirmed cases to prevent the further transmission of the epidemic. Secondly, we launched the nucleic acid testing mechanism for all people in Shijiazhuang and Xintai in an emergency. By the end of January the 7th, in Shijiazhuang City, the cumulative testing samples in Shijiazhuang City was 4.8567 million people with 289 positive results. In Xintai City, the cumulative testing goes to about 1.8949 people with the positive results of 15 cases. And according to the arrangement, Shijiazhuang and Xintai cities have completed the nucleic acid testing completely by the 9th. Thirdly, continuously conduct the tracing work. Province, municipalities, and counties organized the public security, the industry and information offices, and public security, as well as the health commission members, to establish the teams. By relying on the big data mechanism, we will have the tracing work of all of those positive cases, including the close contacts. And in a real-time fashion, we will contact with the relevant people so that the positive cases will be safely transferred to the designated hospitals. And instantly, we will have the tracing work kicked off to get a full idea about the traceability of those confirmed cases and the close contacts. And for those cases that have once visited the other provinces and municipalities, we will send out the letter of a coordinated checkup with the certain entities to speed up our tracking work. But if the source of the virus is not checked yet, we will continue the tracking. Fourthly, we will implement the quarantine measures for the close contacts, and the close contacts of the close contacts must be centralized and quarantined. Every person will be quarantined in one single room, and we stringently execute the standards of the quarantine places. The health monitoring and disinfection must be carried out routinely to avoid cross-infection during the quarantine time. Fifthly, control the mobility of vehicles and personnel. For the people in Shijiazhuang and Xintai cities, they are not allowed to get out of the cities if unnecessary. We will also enhance the transportation control. The passenger vehicles in Shijiazhuang and Xintai cities will also be suspended of operation. Because of the epidemic control, the city's operation, production, lives, and other medics required for epidemic control, if required, the vehicles can get in and out of the cities with valid certificates. And for all of those villages and neighborhoods in Shijiazhuang and Xintai Nangong City, they are closed down. Without an exception, they are not allowed out and only allowed for getting from outside. And for the intermediate and highly risky areas, including the villages and neighborhoods, they will also be closed down. As to the supply of daily necessities of people, we must guarantee the distribution of the goods with enhanced market monitoring to avoid any price skyrocketing. Because of the speculation, we must ensure efficient and timely supply of the products with stabilized prices. Sixthly, we will go all out to rescue the patients. Those patients will be treated in designated hospitals. We will gather the patients, the experts, resources together in the designated hospitals with centralized rescue methods. We combine both traditional Chinese medicine and the Western medicine reorganize multidisciplinary team of rescuers. We will also meet with the national level experts. They will be stationed in the designated hospital to be in part of the rescue of the patients throughout the process. We will also have strict measures to control the epidemic in the hospital to avoid any cross-infection. We will enhance the management of the patients' daily lives and offer psychological comfort to boost their confidence of rehabilitation. By this time, all of the patients and confirmed cases are having a steady condition. Seventhly, we organize the medical supplies for the purpose of saving the confirmed cases. For example, the enterprises producing facial masks, the testing tubes, the ambulances, and ventilators, and other medics for epidemic control purposes. We must have a registry and monitoring to guarantee the supply of raw materials. And we also must have a stocking of the warehouses of those supplies in our province to guarantee adequate supply. With the aggressive support of the Ministry of Industry and Information Technology, we will guarantee the medics' requirements in Shijiazhuang and Xintai and other key areas. In the next step, our province will implement the instructions of General Secretary Xi Jinping under the leadership of CPC Central Committee and the State Council, and the guidance of National Health Commission and relevant ministries. We will accelerate our pace of nucleic acid testing of all people concerned, and we will have the epidemiological survey so that we can control all of the close contacts to the best of our abilities. We will do whatever we can to save the confirmed cases and avoid the further transmission of the epidemic. We must guarantee the life safety and health of our people and stabilize the society. Thank you. Thank you, Mr. Xin, for your briefing. Next, we open the floor to our media friends. And you can raise up your hand and identify yourself before raising the question. In the first row on the left. From the CNG, my question is, as you said, now Shijiazhuang and Xintai already have comprehensive nucleic acid testing. So what is the actual situation of the testing? And we see that the number of positive cases of nucleic acid testing still climbing up. Do you have any measures following? Thank you. Let's give the question to Mr. Liang from the Health Commission of our province. Thank you for your questions. As to the situation of the nucleic acid testing, since January the 5th, we started the comprehensive nucleic acid testing. It's still ongoing. Tomorrow, it will be all completed. Please allow me to brief you about the testing capabilities in our province. Since last year, we prepared ourselves to fight this war. So that's why we have full coverage of nucleic acid testing. For the organs capable of doing the testing, there are about 667. On a daily basis, we can have about 710,000 testing. In Shijiazhuang City, we discovered the first confirmed positive case, and since then, we instantly kicked off the testing of the village where the positive case resided, including the surrounding areas of the village. Shijiazhuang City and Xintai City have already launched their comprehensive nucleic acid testing, covering the villages, communities, buildings, enterprises, markets. We organized the medical staff and sample-taking staff overnight to have orderly taking of the samples. To further scale up our nucleic acid testing to discover any possible positive case, on January the 6th, we went into Dingzhou City and Xinji City, very near to Gaocheng District, for comprehensive nucleic acid testing. Shijiazhuang, Xingtai, Dingzhou, and Xinji have received 40,582 medical staff. And we also take another 5,000 sample-taking staff members in the whole province for the nucleic acid testing campaign. Particularly, it's worth mentioning that our nation dispatched medical staff members from Jiangsu and Zhejiang provinces, taking with them the testing tubes and agents in an emergency to support our nucleic acid testing campaign. During the sample-taking period, to minimize cross-infection possibilities and shorten the time waiting for the testing result in such cold temperature, the party members and the caterers in the village and townships and the property management staff and volunteers used their WeChat groups and telephone calls to inform the common people to come out for the nucleic acid testing with protective measures already done, including the facial masks. As to the elderly people and the patients already lying in their beds or those disabled, there will be some medical staff helping them out by going to their doorsteps to offer the testing services. If any person is tested positive, then instantly there will be an ambulance to transfer him or her to the designated hospital for treatment. For the key villages in Gaocheng District, we already had 2 rounds of nucleic acid testing. In the sample-taking process, our civilians are cooperative. They're quite understandable and supportive of the sample taking. They all fully consider the safety of Hebei province and the whole nation. They have a high awareness and strong confidence of living a healthy life. So, to our general public, I would love to thank you for your active participation and your cooperation. As to the treatment and rescue, we abide by the principles of early discovery, early quarantine, and early treatment, as well as centralized experts, centralized treatment, centralized quarantine. In the treatment process, we also highlight the combination of Chinese medicine and Western medicine to have a multidisciplinary treatment plan. For the respiratory traditional Chinese medicine or the curing divisions, we have organized 840 medical staff to establish 28 teams of rescue, together with national level experts entering into the designated hospital. They will be by the side of the patients all the way. And also, we also ask for the help of those experts who once supported the epidemic control in Hebei province at the number of about 1100. We orderly gathered those experts in our designated hospital so that those experts could continue to contribute to the epidemic control, just like they did in Hebei province, based on their experience of fighting this war. And their scientific treatment experience. For those heavily infected cases, every case will have one team to support him or her. And there will also be one team of experts and one treatment plan. So it's a 1-to-1 service for the heavy cases, with an aim of reducing the mortality rate and increasing the treatment ratio, particularly Beijing, Peking Union Hospital, Tongji Hospital of Wuhan City, and Chaoyang Hospital in Beijing, together with 12 other hospitals. We invited 26 experts at the top-notch level nationally to treat those cases, including asymptomatic carriers, every day. Particularly for the asymptomatic carriers, our experts will regularly check their health status. If they are already at the condition of a diagnosis, they will offer the diagnosis instantly. Otherwise, they will take some other treatment methods, like taking the traditional Chinese medicine or body temperature check. Also, the Xingchi Hospital of Hebei Province is emptied to receive the cases. There are about 500 beds in one hospital and 510 beds in the second hospital of Xintai City to specifically treat those asymptomatic carriers and confirmed positive cases. The fifth hospital of Shijiazhuang City is also the designated hospital for those cases that once flew here on certain airplanes that are confirmed dangerous. And the Jianhua Hospital has about 1,200 beds. Xintai Second Hospital has about 500 beds. We designate those beds for the purpose of treating the cases. Once the situation gets even worse, they will be ready anytime. In addition to the above-mentioned information, we also designate 13 municipal-level hospitals and 2 provincial-level hospitals and 19 backup municipal-level hospitals. We have 50,000 medical staff ready to fight this war. They can take shifts for the treatment. Thank you. Thank you, Mr. Liang. Next question. In the first row. From news agency. In our interview, we discovered that Shijiazhuang communities and villages are all closed down, and people's lives are impacted to some degree. So my question is, what measures have you taken in terms of the market? And in the supermarkets and the other shopping malls, what will be the risks? After all, they may receive more visitors. Let's give the question to Mr. Zhang from the Commercial Bureau. Thank you for your question. Our Commercial Bureau of the province attaches high importance to the epidemic control and market protection. We strictly execute the coordinated prevention and control mechanism of the State Council and the provincial government's requirements. Since the outbreak of the epidemic, we convened the meetings to prepare for the market preparation. And also we kicked off the supply of the daily necessities to guarantee the necessities supply of the whole province on the market. up until now for grains, flour, oil, meat, eggs, and vegetables, and other instant food, we have adequate supply and steady market. Firstly, strengthened monitoring of the daily necessities. To guarantee the steady supply of the daily necessities, we have made some plans of market supply insurance for the 24 key supermarkets and 42 wholesale markets and some key enterprises of food supply. For example, producing eggs, vegetables, meat, flour, and grains. We will have regular market monitoring, particularly in Shijiazhuang and Xingtai. Those supermarkets and enterprises will be monitored strictly to get instant information about the supply channel, warehousing, storage, and others. For the market price of those daily necessities, we also have strict monitoring by working together with market supervisors for any speculation or price skyrocketing ever since the outbreak of the epidemic. We will crack down upon them. Secondly, guarantee the enough supply of the sources of the products. We must establish a mechanism of guarantee supply of the necessities. We guarantee that the agriculture food markets, supermarkets, convenience stores, and the other entities, together with the plantation bases, must be matched to increase the storage so that there will be enough supply in both the retail and wholesale channels. And we must guarantee enough replenishment of the products. Once there is a shortage, we will have a provincial level centralized distribution instantly. For now, grain, flour, oil, meat, eggs, and milk are in adequate supply, and they can meet the requirement of the common people in Shijiazhuang and Xingtai cities. Thirdly, transportation channels must be smoothed. We are working with Transportation Bureau, Agriculture Bureau, and Public Security Bureau with the coordinated efforts for the production bases and the agriculture wholesale markets, supermarkets, and the vehicles for transportation of the daily necessities. We will offer a green channel to ensure that the transportation of the daily necessities will meet no obstacle and will have efficient parking. For Shijiazhuang and Xingtai cities, we also take coordinated efforts so that the village committee and the neighborhood committee members and volunteers could play bigger roles. We must connect the procurement, distribution, and transportation channels of those daily necessities to offer more convenience to our common people. Fourthly, we must guarantee that there will be continuous supply of those daily necessities. By establishing a working mechanism, the provincial and municipal level commercial bureaus are working in a cooperative way by working together with Hebei Xinfadi wholesale market and other big-sized wholesale markets. They will offer enough supplies to the big supermarkets in Shijiazhuang and Xingtai, for example, the eggs, milk, and meat and vegetables. We will also guide different wholesale markets, agriculture markets, and supermarkets to be part of the distribution system. And also we will add the supply of the other daily necessities, for example, vegetables, on the part of the government, so that the government will have more food in supply. Now, Shijiazhuang and Xingtai's total supply volume of the daily necessities is increased. We can certainly meet the demand of our general public. For this moment, we are working with the Ministry of Commerce by establishing an emergency working mechanism for supply guarantee, so we can ensure that the daily necessities from every corner of this country can be dispatched and transported to Hebei province. if required. For the supermarkets or shopping malls, our bureau published a document about epidemic control with certain mechanisms established and measures implemented. We urge the enterprises in our province to strictly abide by the epidemic control methods, including the national level requirements and also the document by the Ministry of Commerce about the epidemic control measures in the enterprises and convention businesses, together with the Health Commission for those business venues, facilities, staff members, and products sold. There must be comprehensive epidemic control. We require the enterprises to prepare facial masks, disinfectants, body temperature facilities, and other medics required. The staff members in the business must strictly wear their facial masks and disinfect their hands instantly. And as required, the whole environment must be sanitized and highly ventilated. For the shopping malls and supermarkets, they must control the total number of visitors. And they are not allowed to stage any promotion activities. Secondly, for the wholesale agriculture markets, shopping malls, catering businesses, the exhibition halls, they will be the key areas of our control. We will also urge the cold chain related the supermarkets, shopping malls, wholesale agriculture markets to improve the sanitation in the environment. And the inflow and outflow of personnel of those places must be monitored. For the catering businesses, they must guarantee the tidiness and sanitation of the environment by increasing the frequency of disinfection and good distancing of different booths. And we also highlight saving the chopsticks, for example, by forbidding the usage of disposable chopsticks. And also different localities must have 24/7 working mechanism so that we can submit certain updates instantly. Thirdly, enhancing the checkup and examination. We work with certain agencies to check the agricultural wholesale markets and supermarkets and shopping malls to check and examine the execution of the control measures. For the enterprises, we also must examine whether they have informed and publicized the epidemic control measures through different channels. We also must check if the shopping malls have put in place the requirements of the visitors must have a distance of 1 meter between each other, and the visitor flow control. Once they have violated the measures, we must take certain punitive measures to guarantee the safety of the public. Next question, please.
我是人民日报客户端的记者。我们最
From
近在采
People's
访中
Daily.
发现呢，有一些地方已经
In
出
our
现了
recent
来自
interview,
石
we
家庄
found
的
that in
无
some
症状感染者和
localities
密切接
there
触
are
者。
asymptomatic carriers and close contacts of those confirmed cases in Shijiazhuang City. So our Public Security Bureau is
我
taking
们河
certain
北省在
measures.
省内
My
在
question is,
周边
in
地区
Hebei
的疫情
province,
防控，在合作方面有哪些具体的做法？
what about your cooperation situation in Hebei province with the other areas? So now let's give the question to the Public Security Bureau. Mr. An?
我省石家庄、邢台发生新冠肺炎疫
Shijiazhuang
情以后，
and Xingtai witnessed the outbreak of the epidemic. According to the arrangement of Provincial People's Government, the Provincial Public Security Bureau kicked off the emergency mechanism.
公安民警、辅警
The public security workers, including the police,
投入战斗，
took actions
立即启动了
instantly.
石家庄、邢台所有高速公路
Shijiazhuang Xingtai highways,
和其他道路
provincial
检查
ways,
站卡点
and the other ways have
对
established
地处石家
checkpoints.
庄市域、南宫市、 及周边县里车辆、人员
Nangong City and the surrounding counties must be examined, and the
立即启动
vehicles
了
entering
环境检查站和进
into
京
the
所有路口卡点
related areas must be
对
prohibited
石家庄
going out.
邢台车辆
All
人
of
员
those established checkpoints will have stringent examination
对省内
of all of
其他
those
地区
vehicles
人
coming
员
out of Shijiazhuang
严
and
格执
Xingtai.
行
They are not allowed
非必要
out. For the other counties and surrounding areas,
环境地区进京通
we will
勤
not
人
allow
员
them
可以凭借
to be on the mobile
或者是
unless
环
it's
境
necessary.
4市15县出具的
Covering 4 cities and 15 counties,
在京工作证明72小
unless
时
they
内
can
核酸
offer
检测
their
阴性
certificate,
证明可以
for
通行
example, the work of permit in Beijing. Otherwise, they are not allowed to get out to enter into
环
Beijing.
京4市15县，比如说三河啊、燕郊这些地方，
For example, Sanhe and Yanjiao
有
County.
效的居住证明，
If they can
72
have the
小
permit
时
of residence
核
or
酸
permit
检
of
测
work
阴性证明，这个可以通行的。
in Beijing, then they can commute between
我们
Hebei
立即启
and
动了
Beijing. In total, we cover 4 cities and 15 counties.
国省道和
We
其他
also
道
launched
路的
the highways, the provincial level roads, and
检
the
查
other
站
roads
和卡点，严格
examination
执行非
through
必
the
要
checkpoints.
不出省。
If unnecessary, they're not
对于
allowed
向石家
to get
庄
out of the
和邢
province.
台地区运送应急物资，
If
特殊
it's
车
a
辆
vehicle transporting the emergency supplies to Shijiazhuang and Xingtai,
和司机
for such
在
special vehicles,
互联网
the
下载
entities
打印这个进
and
出
the
河北
drivers
疫情
must
防控
download from the
应急
internet
物资运输车辆通行证，
Hebei Province
在互联网
permit
下载打
of
印
transportation
进出河北疫情防控应急物
for
资
the
运输
epidemic
车辆通行
control.
证，自行填写，随车携带。
They
并
must
持有
take the
7日内
certificate in the
核
vehicle.
酸检测
And also the driver must have a nucleic acid testing negative result within the past 7 days. And also the driver must have normal body temperature.
这个
Then they
减
will
少
get a
人
pass.
员和车辆的流动，是阻断疫
We
情
will
传播的
reduce
关
the
键。
mobility of the personnel and vehicles. That's the key of preventing transmission of the virus.
不外出，
Again, I call upon our
非
people
必要
to
不进京，
maintain at home
非必
unless
要不出省。
necessary. And also, they must not get out of the province and not enter into Beijing unless it's necessary. So thank you for your coordination. Thank you, Mr. An. Next question.
一排左侧这位先生，
On the left
你
and
好，
in the
我
first
是
row.
中新社的记者。我
Thank
想问
you.
一下，本轮疫情发生以来，
My
交通运输
question
部门
is,
在
since the outbreak of the
疫情防
epidemic,
控和
what
保运保供
has
有哪些具体
the Transportation Bureau done in terms of the
这个问题
epidemic
我们
control?
请这个交通厅
So we will give the question to Mr. Wang Puqing from the Transportation Bureau.
谢谢主持人。这个省交通运输
Thank you
厅
for
啊
the
在疫
question.
情防控以前，
The Provincial
全面落
Transportation
实
Bureau
国家
has been
河北省和交通运输部
comprehensively implementing the
最新的
requirements.
要求，实施动态调整防控方案，
We timely readjust our control measures so that personnel and materials will be prevented together
传播扩散。
so that we can stop the transmission of the virus through transportation channel.
这方面的工作啊要
First of all, for the passenger vehicles, we will have higher control
为保证人民群
during
众
the
的
period
安
of
全
comprehensive nucleic acid testing to guarantee the safety of transportation and commuting. Since January the 6th,
到石家庄和邢台的
we stopped
省际和省
the
内的
vehicles
单线
with the destination at Shijiazhuang and Xingtai,
和邢台的
taking
道路
passengers.
单线
For those
禁止在这两
passenger
个省内
vehicles
呢
passing through Shijiazhuang and Xingtai,
那么
we
对石家庄和邢台省
prohibit
以外的
the
进京的
passengers to get off board. For those passenger vehicles entering into
在
Beijing
检票登车前
in before the passengers get on board, we will have stringent
有效的
examination.
阴性证明
For
才能
example,
登车
negative nucleic acid testing results of the passengers in the past 72 hours.
有些旅客要办理这个退票的，售票单位呢一律
If the passengers want to rebate their tickets, they are all allowed. And also, the personal safety insurance is also allowed. We also stopped all the vehicles from entering into Beijing, Shijiazhuang, and Xintai. Also, the taxis must have real-time monitoring. We stop the taxis to enter into Beijing, Shijiazhuang, and Xintai. Also, we urge the other Uber-like platforms to have stringent control. We do not allow such cross-city order-taking on those car-hailing apps. As to the airports, the passengers in Shijiazhuang and Xintai must also take the negative nucleic acid testing results in the past 72 hours. Otherwise, they are not allowed to get on the airplane. With those measures, we have basically completed the curbing of the virus through transportation channel. We will not allow the virus to be spread to Beijing and other places in China through transportation channel. Our passengers are totally understandable and cooperative. There has been no gathering of people or no conflicts because of such control measures. So, on behalf of the Transportation Bureau, I would like to thank our passengers. Secondly, about enhancing the regular transportation-related epidemic control measures. For example, urging the passenger vehicles, the taxi drivers, the stations, disinfection and body temperature check, the health code check, facial mask wearing. If there is any case of fever, we will report the situation. And we also recommend the staff members in those places to increase their protective level. We will strictly implement the requirements concerning the cold chain food products enter into Beijing. The sample taking, the cold chain vehicles, the staff members' nucleic acid testing, and emergency treatment mechanisms are all implemented. So we've done a lot in terms of cold chain. The third measure is about the supply insurance of emergency materials. For Shijiazhuang and Xintai, the vehicles sending the supplies to the two cities, they will enjoy a green pass to ensure that the medical supplies and daily necessities going to Shijiazhuang and Xintai will be insured. We will ensure the effective transportation, the effective capacity, and the effective protection of those medical staff go to Shijiazhuang and Xintai. Yesterday, along with those above-mentioned control measures, all of the highways in the province have seen about 1.82 million vehicles, a decrease of 15% compared to the previous level. So the traffic flow has been going down with the transportation control measures. There are 127 passenger bus stations in Shijiazhuang City. The Shijiazhuang Airport has received 13 airplanes yesterday, with a total number of 744 passengers on the airplanes, a decrease of 94% compared to the previous level. Today, since there is a sharp decrease of airport passengers, all of the airplane companies haven't prepared any flight today. Thank you. Next question. The lady in the second row on the left. From China Daily. As to the source of the epidemic, we are very curious. Some of the confirmed cases had the symptoms of cold since December the 20th. So what is the conclusion of the source? And also, when we trace, we also see a lot of gathering activities like a wedding or funeral. And also there is mentioning about such regular activities in the villages. What are you referring to about such gathering activities? We will give this question to the CDC branch in Hebei province, Mr. Li Qi. Thank you for the question. After the outbreak of this epidemic, we have a sequencing. So very quickly, we clarified that it's an imported case in the beginning from abroad. But as to the source, national, provincial, and municipal experts and departments are still finding the reasons. As to the relationships between the different cases, we used big data and epidemiological methods and also sequencing and tracing techniques. As you know, the cases are mainly concentrated in Gaocheng district. But as to the cases in other places like Xintai, with our investigation, we found that they are all related. By that I mean all of those positive cases were infected by one case. Thank you. Next question. From Hebei Daily. My question is, for those prioritized epidemic control areas, how does the Transportation Bureau implement the epidemic control measures and the transportation guarantee work? So we will give the question again to Mr. Wang. Thank you for the questions. For the future epidemic control measures, yesterday we worked overtime to make the plan of strengthening Shijiazhuang and Xintai cities' transportation epidemic control. We also specifically made plans about railway, the flights, waterway, the postal services, and the delivery services. And the priorities are as follows. Firstly, transportation control. According to the requirement of the wartime epidemic control, we will take stringent measures to control the high-speed railway stations, airports, the bus stations. Together with the Public Security Bureau, we will control the channels of transportation to defend the civilians. The vehicles and the passengers passing through must be checked thoroughly to guarantee that the personnel, the vehicles in Shijiazhuang and Xintai cities will not get out. We also take practical measures to manage the cold chain and the loaded food items refrigerated. We will also do good disinfection of the containers of those cold chain food items. Secondly, we will have smooth transportation system to guarantee that Shijiazhuang and Xintai will receive the needed daily necessities and medic supplies. We will take firm measures as long as Xintai and Shijiazhuang city asked for certain medical supplies and daily necessities. Our Transportation Bureau can guarantee the supply of those items within 24 hours. If necessary, in the surrounding areas of Shijiazhuang and Xintai, we will set up emergency transfer positions for those supplies. Nationwide, there will be some supplies transferred to those transfer points. then we can avoid cross-infection of the van's
严
drivers.
格执行这个电话值班值守制度。我们向全省
Also, we have a hotline
值班
system.
电话，保持
The hotline is open to the
24
public,
小时畅通，及时受理和
and the
解决
hotline is operational 24 hours
通信中
per
的
day.
相关问题。这是第二个。
We will try to solve any question emerging in the transportation process.
关注
The Transportation Bureau is also paying high attention and supporting the provincial level efforts of epidemic control. The notice is given out to the whole province. For the vehicles sending out the emergency supplies to the whole province, we will offer a green channel to the drivers and the vehicles. The drivers must print the document called the Provincial Level Vehicles Pass for the emergency supplies transportation. The driver must take it. With that, we will offer a quick pass. The third measure is to take strong measures to guarantee the transportation. We organize different cities to have a stronger capacity of transportation. There will be some voluntary fleet in the postal services or the delivery businesses, so the daily necessities could have efficient transportation. In the meantime, for the service positions, there will be higher frequency of disinfection, including the vehicles and the staff members working in the transportation channel. We also implement the State Council General Office's notice on the Transportation Bureau's work to guarantee the regular transportation of the vehicles. In a short time, for the vehicles sending emergency supplies and for the drivers driving those vehicles to Shijiazhuang and Xingtai, once they're checked with normal body temperature, we will not ask them to be quarantined for another 14 days in principle. The Transportation Bureau will implement those instructions to guarantee the safety of the staff members in the transportation sector and the smooth transportation of the necessary supplies. We must ensure that the virus will not be spread through transportation. Next question. The gentleman in the second row of the left. From Hebei Radio. Since there are so many infected cases in the villages, we are very concerned about the further transmission. And what's your forecast about the transmission in the future? Now let's give the question to Mr. Li Qi. Thank you for your question. Based on the current information, including the control measures and epidemiology, our experts came to the initial conclusion that even though the main cases are concentrated in Gaocheng district, for the other 13 counties in Shijiazhuang City, it is reported that there are some cases and asymptomatic carriers. Since we're intensifying the efforts of nucleic acid testing in the next few days, there might be some new areas with confirmed cases. Shijiazhuang City has been closed down. So we effectively cut off the transmission. In the future, there may be some positive confirmed cases through the nucleic acid testing, but they are totally within control. I think the risk of further transmission of the virus is very low. In addition, for those positive cases and the close contacts, there may be more confirmed cases coming from them. But as I said, they are within our control. So the risk of transmission is low. Thank you.
异议提问。
Next question.
右侧这位先生。
The
你好，
gentleman in
我
the
是
second
长春
row
新媒体的记者。
on the
我
right
想问的是，
from
在
Changchun
疫
New
情防控
Media.
最关键的时
My
刻，
question is,
大家都应该做好个人
at the
防护。
critical moment of epidemic
当前
control,
人们
everyone
最
is
应该注意
responsible.
的哪些事项？
And what are the pointers for the common people at this moment? Could you give us some suggestions? Let's give the question to Mr. Li Qi.
感谢提问。
Thank you for the question.
因为当前呢，就是大家知道，处在了咱们一个防控的一个关键时期。
Now we're all at a critical moment of epidemic control and prevention. So at such an emergency time, we want to offer you some reminders. First of all,
当下的核酸检测，核酸检测。
you must cooperate
如果说是入户的，
in terms of nucleic acid testing,
在排队检测的时候呢，
particularly if our staff members go to your doorstep. And if you go to the centralized position of nucleic acid testing, keep a distance from others and wear your facial masks.
其实大家都
And secondly,
熟记于心的，咱这些良好的习惯，比如说戴口罩、勤洗手。
try to maintain a good habit. For example, wash your hands, good ventilation, disinfection, and the 1 meter distance from others. Those measures are effective.
措施去做，包括
And please
具体等等。
try to avoid gathering with
还
others.
要提醒大家，一旦要
Another reminder,
比如说发热或者干咳，
once you have a fever or a cough
这呼吸道症状，千万不要惊
or other respiratory
不要
symptoms,
惊慌，一定要呢戴上口罩，
do not panic.
到附近
Wear your facial mask and go to the surrounding fever clinics
可以呢，
for treatment. Do not take public transportation.
及时呢进行救治。
You can choose to drive there or be sent to the designated clinic
感谢
by
8位
your
记者
family
的
members.
这个
Thank you
同时也
all
感谢
for
我
the
们
8
各位嘉宾的
reporters
这个
for your questions. And also, I want to thank all
今天
our
的发布会到此结束。
panelists for your answers. This is the end of the presser. Thank you.